From one dire situation to the next, the South African National Blood Service is reporting a drastic decrease in blood donations compared to the previous year. The South African National Blood Service is warning that it's currently below its recommended 5-day supply. Medical Director Dr. Karen van der Berg joins us now to speak to us about how dire the situation actually is. I mean, it's quite alarming, Doc, that we've got less than 5 days worth of blood. Those needing transfusions are actually at quite a high risk at the moment, aren't they?
Indeed, yes, the situation is very alarming, and it has unfortunately been quite a protracted period of low stock levels. We generally see this kind of situation for a week or two early in January, but then it normally settles. But we have such an unprecedented demand on blood for this January that we have really been struggling to get out of these doldrums that we find ourselves in.
What are some of the reasons that have been cited for people just not donating blood, particularly at critical periods such as this one, as you've mentioned, blood being in huge demand?
So over the last, 18 months, almost 24 months now, the COVID epidemic obviously played a very big role. We have had a situation where the normal places we go to find our donors, such as workplaces, schools, universities, those places have either not allowed us to come in, or when we go there, there are so few people there compared to what we normally see, because people are either working from home or studying from home. So that's the first thing. The people are just not where they used to be, and we are busy adjusting our process to that. But also, we take all of the precautions that we possibly can. The video you're showing at the moment, for example, was taken pre-COVID. But, during the COVID period, the measures that we have put in place to protect our donors also kind of limits the number of people that can be in a facility at any given time. We clean everything before and after every donor. So all of these things have contributed to a less than normal supply. And then, as I said, there was this very big increase on the demand for blood during January.
Is it not important, Doc, for the National Blood Service to re-look at the way that they collect blood? Because of the advent of the pandemic, a lot more people working remotely are no longer gathering at institutions such as universities or office parks. Are there conversations that you are having as an organization to maybe rethink the way that you collect blood?
Yes, definitely. And we have been working on this over the last couple of months. So we are doing things a little bit differently. We have commissioned vehicles that we use so that we can go to places such as big housing estates and put up camp there, so that people can literally come from their living rooms to come and donate. We have also partnered with some of the big companies where people still are on their normal workplaces. We had a really big successful drive with one of our courier companies, Skynet, over the week. So this is, we are definitely, but these things move slowly. We have to comply with very strict regulations to make sure that we protect both our donors and the people that receive the blood at the end of the day. So it's not as, things don't work as quickly as we would like them to work, but we are definitely revisiting and relooking the way in which we approach blood collection.
Dr. van der Berg, maybe give us a sense of the minimum of blood that would be required just to make sure that we are on a safe level when it comes to the provision of blood to those who absolutely need it. What is the minimum amount that we should be sitting at in general?
So in the pre-COVID days, we were adhering very strictly to the World Health Organization recommendation of 5 days. During COVID, we have mostly been able to maintain a supply of around 4 days, which is still, it is still okay for South Africa to be sitting at 4 days. It's not ideal, but at 4 days, we know that we can meet all the demand all the time, all across the country, because people must remember that there are people in Lusikisiki, in my home province of Gauteng, the Eastern Cape. I've recently relocated to Gauteng, but in the Eastern Cape, in the Sikisiki, we need to have blood there. We need to have blood in Kuruman in the far Northern Cape. So at 4 days, we can manage that. At 3 days, we really start struggling because when somebody donates a unit of blood, it takes us about 2-3 days to get it to those places because we need to test it and process it. So 4 days is comfortable for us. 5 days is ideal. 3 days is starting to get really difficult. Below 2.5 days, we run into serious trouble.
Yeah, absolutely. And with that, how many transfusions do we see in South Africa on an annual basis?
So we issue more than 1 million units of products a year. So products include red blood cell products, platelets. We always need platelet donors, plasma donors. So in excess of 1 million products. We collect about 850, 900,000 units of blood from donors every year. So we have more than 1 million people. And I think it's important for people to understand the scale of our organization. So we have more than 1 million people walk through our doors every year to donate. We put needle into arms more than 900 times a year, 900,000 times a year. And out of those products or donations that we collect, we then produce more than 1 million products that we issue to our patients across the country.
Very worrying but interesting insights there from Dr. Karen van der Berg, who is the Medical Director at the South African National Blood Service. Thank you very much for your time this morning. Just painting a picture about how important it is to actually donate blood. We are running very thin, so if you can, find yourself the nearest centre and do your part in contributing to the blood offering in this country.